Welcome to our podcast, Psychiatric Services, From Pages to Practice. In this podcast, we highlight new research or columns published this month in the journal Psychiatric Services. I'm Lisa Dixon, editor of Psychiatric Services, and I'm here with podcast editor and my co-host, Josh Berezin. Hi, Josh.
Hi, Lisa.
So today, we are once again not going to talk about 3 articles from the journal.
It's a trend.
It is a trend. Trend is a specific statistical term, you know. Okay. Anyway.
We're getting off to a good start.
I know. Here we go. We are not going to be talking about 3 articles because instead we are interviewing the author of the introductory column on social determinants of mental health, Ruth Shim.
And I think it's a great conversation, and we hope you guys enjoy it. So we want to welcome Dr. Ruth Shim, who is the Luke and Grace Kim Professor in Cultural Psychiatry at UC Davis, and she's going to talk with us about a new column in Psychiatric Services on the social determinants of mental health, and the inaugural column addressing the social determinants of mental health, if not now, when? If not us, who?
I am so excited to have Ruth Shim here on this podcast. She's always been somebody I've admired. Welcome, Ruth.
Thank you. It's really great to be here with 2 people that I admire.
Oh, wow. Thanks. So maybe you could start off with just telling us a little bit about the column, and then we can go into it in a little more detail.
Sure. So the column is edited by myself and my close colleague, Michael Compton, and it really aims to think about clinical and policy issues that relate to the social determinants of mental health. And we define the social determinants of mental health as where we live, learn, work, age, and play, and all of those things that end up having an impact on our overall mental health. So we're hoping that this new column will help us to understand how the social determinants of mental health relate to issues of mental health equity, and how they can contribute to the mental health disparities that we see. And we're really excited about trying to focus on solutions and things that we can think about that will help us figure out the best ways to address the social determinants of mental health.
So how did you initially get interested in this work?
So I did my psychiatry residency at Emory in Atlanta, and Atlanta is a really interesting, probably actually a common city in that the medical school is located in a kind of nice part of town. It's in kind of a more suburban part of Atlanta. It's where kind of all of the rich people live. And so there's the medical school, and then there's the associated public hospital, which is Grady Memorial Hospital, and that's located in downtown Atlanta, in probably one of the poorest areas of downtown Atlanta. And early on
Grady's kind of famous. It's almost legendary.
It is.
Yeah.
It's quite legendary. I was really excited to go there for medical school and for residency, but I started noticing very early on in residency, because I was able to rotate both at Grady Memorial Hospital and at Emory University Hospital, that I had patients that had the same diagnoses, would come in with the exact same issues, and the patients that I was treating at Emory University Hospital for those issues, I'd give them medication and they'd get some therapy, and they would improve over their hospitalization, and they'd leave, and I feel really good about the work I was doing. And then I would go to Grady and treat people with the exact same diagnosis, provide the same care, same type of therapy, and I noticed that those patients were not improving. And so I really wanted to try to understand what was leading to the inequities in outcomes that we were seeing, why one population of people was having really positive outcomes and really responding to the treatment that we were offering, the mental health treatment, and why other populations giving the same amount of care and the same amount of attention were not responding in the same way.
Maybe we could just take a step back also for a second. And I think that a lot of people now understand what social determinants are because, as you mentioned in the column, it's really become an area of research. But do you have a quick and simple way of explaining what social determinants are to people who haven't heard about them before?
Yeah, so actually, it's really interesting. The Robert Wood Johnson Foundation did some research on this a couple of years, probably like 15 years ago now, where they discovered that the actual term, the social determinants of mental health, is not very well received by
Hmm.
everyone of every political background. And so, while everyone wants to address these issues and everyone thinks that they're important, depending on your political background, you may not like the term social determinants of mental health. So they did extensive research to figure out what's the best kind of wording, what's the best things you can say that really defines the social determinants of health. What are words you can say instead of saying the social determinants of health? And the one that really kind of tracked the best, the phrasing that worked the best, no matter what your political background or your belief structure is that your zip code may be more important to your overall health than your genetic code. So if you look at it kind of on a whole, I think the best way to think about it, and the way that I try to think about it, is there's really clear data. Like you can actually take almost every county, every city in the United States, and if you look just at the county level, you can see huge differences in life expectancy. We're talking about up to about 15 years difference in life expectancy
Wow.
in certain counties across the country. But you can go, the level that you look at it, you can actually go really deep into granularity on this. So you could actually, for instance, look at Manhattan and you could see life expectancy differences at certain subway stops. And we're still talking about significant age differences here, about 6, 7, 8 years life expectancy differences depending on what stop on the 6 train you're on, as well as here in California you can look at I-99, and that's a major highway that goes through the San Joaquin Valley. And there are huge life expectancy differences there as well, up to about 15 years, even between 1 or 2 exits on that highway. So if you put that together with the idea that people with serious mental illness die that on average, significantly earlier than the general population, then you have kind of this perfect storm of mortality around people with serious mental illness as it relates to these social determinants. And it leads me to believe that that's kind of all of those factors together really end up being kind of driving forces behind why we see these gaps in mortality that we do, particularly among populations with serious mental illness.
So let me see if I can understand what you're saying. Are you suggesting that part of the increase in mortality experienced by individuals with serious mental illness may be due to social determinants of health rather than, say, the specific mental illness? Or
Exactly. That's exactly what I'm saying. And it's a different way that I think we've gone about thinking about these things. But if we try to kind of look at that mortality and dissect it a little bit more, the things that people with serious mental illness die of are kind of very similar to what the general population dies of.
Yeah, I think of social determinants as more of an approach and thinking about individual level outcomes, right? We like to think about, a person has a lot of control over where they go and what they're exposed to and what they eat and the kind of experiences that they have. But thinking about the highway example, right? So like that population might have a high rate of asthma and might keep on going to the emergency room for asthma over and over and over and over again. And one approach might be, well, we've got to improve the way that we treat asthma on the individual level and come up with the best inhaler and the best distribution of medications. But really what you need to do is move the highway, right? You need to step back and look at
that's easy.
Right, much easier than distributing. Right, we're easy problems, easy solutions here on From Pages to Practice.
Right. And it doesn't necessarily mean moving the highway, but maybe it means figuring out a way to decrease the pollutants and contaminants that are coming from what's on that highway.
Right.
Like that's an easier intervention.
So this makes sense to my brain. It makes sense to your brain, but I know that it doesn't make sense to everybody's brain. Have you come across a lot of resistance when you're talking about this sort of work? And what is that kind of resistance? And what do you usually say when people aren't quite, when their brains don't?
When they're not getting it.
When they're not getting it.
So I have come across a lot of resistance. And I think it has a lot to do with the fact that, and we try to address that in the article, that this is kind of a bit of a political topic. There's political aspects to this. And as a result of that, I do think that there is a lot of opposition and a lot of thoughts that maybe this isn't okay. One of the biggest things I hear from people, particularly psychiatrists, but I think lots of mental health professionals, is this idea that, as psychiatrists, we're supposed to be neutral, kind of in this Freud mentality of really not taking a political stance or a perspective on things, maintaining a certain neutrality. And I think that when thinking about inequity and how inequity forms, and particularly how we develop the mental health inequities that we see in our own society, not acting and being neutral in a situation like that is almost just as dangerous, if not more dangerous, than picking a side or making a political statement.
Let me kind of follow up on that a little bit if I could, because we have in our group and our colleagues amongst our community, we obviously have people who have of different political persuasions. But I wonder what you think of the notion that regardless of whether one believes that you have a responsibility to act on a population level, on your community level, in your neighborhood, there's a responsibility of a clinician to understand what may be driving the illness, the symptoms, the treatment choices, the response to treatment of their patient. So that, even if one chooses not to be quote unquote active or political or whatever, still as mental health professionals and as individuals who are part of agencies and programs that work with people, I guess I'm going to ask, can we contest, and I asked Josh too, is there any debate as to whether it's our responsibility to understand what might be impacting the health and treatment of our patients?
I think that's a really great question. And so I think probably for a small group of people there is actually debate about that, but I would optimistically state that as a field, I don't think there is any debate.
I mean, I think you sometimes hear an objection, well, there's nothing I can do about that, right? There's nothing I can do about societal racism, and there's nothing I can do about income equality.
It's hard enough to treat depression.
Right, it's hard enough to treat depression. How can I take on these big things? And maybe we'll get to that question in a second. But there's all sorts of things that we ask about people that we have no control over, right? It's not like we say,
right.
Oh, it's not important for me to know about your history of abuse when you were a child because I can't intervene on that issue. That doesn't make any sense, right? We can't actually understand anything about this person without understanding the context. And we are comfortable asking about kind of like the family context of that. But once we start talking about the societal context, we kind of get a little bit twitchy about that for some reason.
It's true. It's true. I do think it's worth commenting that the particular social determinant of mental health, of discrimination, works very differently than the other determinants of mental health. So we've looked at the data across all of these determinants and found lots of data on physical health, minimal data on mental health. But interestingly enough, for discrimination, it's the opposite. we found lots and lots of data on the mental health implications and less data on the physical health implications. So this is one particular determinant where the evidence kind of overwhelmingly supports that this particular determinant has a massive impact on lots of different mental health outcomes. And yet, it's not something that we tend to talk about in a clinical setting. We probably don't ask our patients routinely about their experiences with discrimination. We just kind of shy away from it. And I think it's as you said, Josh, we're a little bit twitchy. Yeah, we're a little bit twitchy about these topics. These are complex topics.
Is there an interview that reviews the social determinants of health? If you wanted to, I'm thinking about the cultural formulation interview as a nice tool. Is there a tool?
Yeah, so the cultural formulation interview is the closest thing we have. And that doesn't kind of fully encompass all of the social determinants. There are a couple of population health companies that are working on creating screening tools to look at the social determinants of health. But I'm not aware of any particular interview guide or screening tool that's specifically around mental health or around doing a psychiatric interview or a diagnostic interview that addresses these things. So that's, I think, an area that the field, a direction that the field needs to go in, and maybe a next step in how to start thinking about these things.
And in terms of other next steps, what about that idea that there's nothing that to be done about the social determinants, that mental health professionals can't intervene on these issues? What are the sorts of things that people can do to actually have an impact here?
Well, I tend to think about that idea of thinking globally and acting locally. So if you think of it from a perspective of, okay, all we need to do is change all of our federal laws, then yeah, you can feel pretty helpless about that situation. But I think a starting place for most every provider, clinician, or person who is delivering care would be to kind of look at what your clinic or your health system or your private practice, like what you're individually doing around some of this space. So things like making sure if you work in a community mental health center that you've provided appropriate resources or you've created an appropriate resource list for how to help people that are unemployed or to help people access housing, and putting those structures into place in your clinic are little things that you can do, or even just looking at your clinical setting and making sure that you're considering some of this. Another really great example of like a really little thing that it's maybe not little, but I consider it to be little. A really little thing that you can do is there's a really effective way to address the social determinants of mental health called medical legal partnerships. Which is where a lawyer is embedded in a mental health setting or in a clinic environment.
I think we've had an article on that in our partnership column, if I'm not mistaken.
Right, and they really are starting to pick up a lot more, and we're starting to see really positive outcomes associated with these partnerships.
Yeah, what I really like also about what you've said is that you're taking the population issue or the cultural or community issue and then bringing it down to the level of the person.
Exactly.
Is that correct?
Exactly.
Okay.
Yeah. And in the article we talk about addressing public policies and changing social norms. And so, the policies are a big point. And just as you said, policies don't have to be, big, huge policies, but they could be individual administrative level, institutional level, or clinic level policies. And then the social norms piece is just as important from an individual level. The idea of cultivating inclusion and cultivating a spirit of inclusion and acceptance. So from a clinic level, what that looks like, if you're thinking about, trying to do something locally, is, maybe review the patient experience that folks have in your clinic setting and say, is there anything that I'm doing here that is not is subtly sending a message of discrimination or exclusion. It could be as little as, the way the waiting room is set up, or, how you structured the use of restrooms. It could be, healthcare system policies about, how you address people of different genders, or transgender people. I mean, there's smaller things that can also be done on a very more individual level that can have an impact on social norms, which then can kind of lead to a change around social determinants as well.
So we'll be looking forward to reading more about social determinants and service delivery in the next column. And we just want to thank you so much, Ruth, for joining us. This was a great conversation and such an important topic, and we're really happy to have you.
I'm very grateful to Michael and Ruth for taking this on and I think adding a really, really important dimension to the Journal Psychiatric Services.
Thank you. I appreciate you all having me, and I enjoyed the conversation.
Well, that concludes another podcast, Josh.
We did it.
We did it, and we're going to be back in
August.
It is. August comes after July, right? It's very hot in July, and I think we're going to be hoping for just a wonderful, cool August. No?
Yeah, well, I'm hoping to turn the AC back on in here.
Okay. We invite you to visit our website, ps.psychiatryonline.org, to read the article we discussed in this episode, as well as other great research and information. We also welcome your feedback. Please email us at psjournal@psych.org. You can also rate and review the podcast on iTunes, Stitcher, or wherever you listen to it. I'm Lisa Dixon.
I'm Josh Berezin.
Thank you so much for listening. We'll talk to you next time.
And a special thanks to Dr. Shim again.